Hello, and thank you for joining our recorded workshop on PPR review and conversation. This is a conversation that was hosted at an AOK Networks teleconference in March of 2022. The purpose of this session is to make a connection between planning, reporting, and implementation efforts as you gain insights and develop next steps to improve the next round of reporting. By the end of the session, you will have defined next steps to bring to your next round of PPR reporting. For our agenda and timing, we will have time for the presentation, which will come to about 30 minutes. We will talk about observations from review of the PPR, the Periodic Performance Report, that's due 2 times a year, lessons learned, more and less, and then next steps. Where it says 20 minutes for conversation and Q&A, I'd like you to have a pen and paper nearby for note-taking. I encourage you to invite another coordinator or a colleague to join you for this session. And if you do have questions during the Q&A period, I would encourage you to take notes for those and then bring them to the state team after you're done watching this webinar. Before we get started, as always, I want to thank you for attending this session. So everybody gets a thank you. And if you completed your PPRs and you're watching this again, thank you all for submitting your PPRs. Our first area of focus today is to connect the plans that were created in fiscal 22 to the fiscal 22 quarter 1 and quarter 2 reporting. Now, even though this session is recorded for fiscal 22, it's important to watch because it'll help you make sense as you're reporting in fiscal 23 and fiscal 24. Overall, this is really a session just to help connect the ideas of the PPR reporting best practices and learning. So how are those PPRs reviewed? So first, Lenore from the state team downloads each report and she creates a file for note tracking. Her report includes outputs, outcomes, and evidence of success. So these are the items that you submit into the PPR, and then they are reviewed by the state team through a spreadsheet. Those are next reviewed and then consulted in partnership with Anna Maria. We keep our eye on implementation progress and barriers, creativity, new ideas, training or TA that's taking place, what are your needs for this year, for next year, and then overall alignment with the plan and with the conceptual framework. Big picture is this is less about compliance and more about continuous improvement. So what are you learning? Where are you growing? What pivots? How do we adapt and learn from the data that's being entered in these reports? I want to link your work on plan and reporting to a training that was provided on outcomes. The AOK network, we have a general chain of outcomes that goes from the approaches side over to the long-term child impact outcomes. So this chain of outcomes informs all of our initiatives. Of course, we say we go slow to go far, and this reminds us that all of our work, all roads, lead to these long-term outcomes. So we have an approach, we see some system improvements that are related to the root causes from the root cause analysis. Then we see better system outcomes, some specific system issues are changed. From there, we might see better family early success outcomes, which leads to better child early success outcomes, which in the long run lead to better child impact outcomes. And all of this is connected to our developmental pathway and our conceptual framework. So for example, we might have an approach that is addressing root causes that are related to developmental screenings. More providers understand the importance of developmental screening. More providers are talking to parents about developmental screenings. More providers are assisting parents with scheduling their children for screenings. More parents are getting their kids screened on a routine recommended schedule, which then results in more children who need services are getting connected to those services, leading to more children are reaching social and emotional milestones. So you see this chain of outcomes. It informs all our initiatives working from the left to the right from approaches all the way to long-term impacts. So we expect to see results in kind of this green area, and we hope to see results in the yellow area. So your approaches work in this direction to reach your outcomes. Outputs are a thing that you do as a part of the approach effort that leads to an outcome. So they're the things that are done that lead to an outcome. So approach, we do an output, we do a thing, we get an outcome, we see something. It's getting us towards our objective, which is getting us towards these long, medium, and short-term outcomes. And what we're seeing in the reporting is progress on our outputs and on our outcomes in the PPR. It's that middle section right there. So I'm trying to make all these connections in our review about your plan, about these measurable outputs, about your effort, description, and the results that are described and documented in the PPR process. So it's the same for all three initiatives. So we have these long-term outcomes, which in your plan is reflected in that pinkish reddish color. Our midterm outcomes are in the blue, and our short-term outcomes are in the green. So approaches, green, short-term outcomes, medium-term outcomes, and long-term impact. So those objectives that are written, that's where we're getting some of our data from. So if you notice that projected measurable outputs, those are things that we document in the PPR. All right, so what are we looking for when we review? So first, the reports are used to inform any upcoming professional development or training needs, again, to look at that implementation progress. How is work moving forward? Are there any obstacles that you're encountering? And what kind of opportunities are there for storytelling or for peer learning and connection, not only among AOKs, our AOK networks, but what about other collaborations that are going on around the state? So what are we looking for in review? Are results aligned to your outputs? Are the barriers described in your results? Does the documentation that you're providing, does it match the approach? Does the status update align with what you're reporting and with actual progress? And then what pops? So what might be good to share with others, with publics or peers? So if you have any questions, make sure you write those down. So results and insights, what are we seeing? What else is standing out to us? Well, some technical observations. We would say that I've seen some effort descriptions that are written with the outputs included in that effort description. Personally, I found that very handy for making sense of what I was looking for to see what kind of outcomes are coming as a result. There are outputs that are connected to the efforts and to the results that we're seeing. Folks are using AOK box folders and labeling those by the approach number, and then used for reporting, documentation, and implementation. There's documentation or results description that includes barriers experienced in the approach and implementation. So that's using and applying PILA. There's a good use of copy and paste where the approaches may overlap across initiatives. It's kind of a crosswalking. and then networks that are integrating network capacity with one or more other initiatives. It may even be that some folks are reviewing the root cause analysis with their partners by the way that they're labeling their agenda to help stay on track with the work that they're doing. One thing we want to point out is that effort descriptions should not be a copy of the approach. We want to know what efforts are taking place, so what's being done to move you forward towards outcomes. So what else we're looking for is to remember to continue deepening your connection to parent engagement and human-centered design. The idea of working with our users or stakeholders. And we know this is hard. It's been a weird few years, to say the least. What we know is if people are burnt out and they want to also be included in decision making. So that's really hard. People are tired and they don't want to be left out. So the idea, nothing for us without us, it's a great saying to remember. People are more likely to support what they've been able to create. So what does that mean? From our conceptual framework, when we involve families in the development of the system, they are more likely to show up. People support what they create. So we always want to be engaging. We always want to be reflecting. We always want to be seeking and finding. Why is that? So we respect and honor our parents and caregivers' inherent strengths, wisdom, and capacity to care for their families while we build a system of services and supports that increases family satisfaction with the system while improving service access, quality, equity, and capacity. We do this by engaging parents from the beginning in the planning and design of meetings, outreach events, support groups, etc. So we stretch, we can go beyond marketing campaigns as engagement by adding one-on-one calls. So a marketing campaign is brilliant, it's wonderful, and it can be passive. So a reader, a parent could just see it and move on. So social media doesn't always engage. They might want to have a question asked. They might want a follow-up call if there's a poll or a voting. How can you leverage those marketing campaigns, kind of a passive marketing campaign, to be more active and engaged? Think about vision. Think about obstacles. There's so many, right? So start small. I like that idea of always be selling, always be engaging, always be reflecting, always be inviting parent voice, ideas, involvement in developing topics, messaging, outreach strategies. What else? Take your pen and write them down. Thanks. So what else are we starting to see? We're starting to see some variance in what is entered between effort and results. And it might be that it's our job to provide some technical assistance to clarify what we want to see here. Perhaps more work is being done than is being recorded. So not all networks are including documentation or reporting for all of their work. On the opposite side, and the other end, is not all details are required in reports. So some of our networks are giving a lot of detail on results for every step, some for every approach. Think kind of high level. So what is really going on? I've been seeing that a lot of coordinators have systems to create efficiencies and save time in their reporting and documentation, and this is amazing. And we hope that you'll reach out to your peers to figure out how it is that they're organizing their AOK box. And that idea of enter as you go could be a time saver for some folks. So other thoughts are, there's a difference between projection, what will happen, what I expect to happen, versus an objective of what I want to see happen. So what took place and what is the next step. So we tend towards, so now what? So we can ask ourselves, so I planned this activity, I had this effort, I was hoping to have something happen. What did I do? And then what happened as a result of that? So I would just say everything is informative, so detailed or not, keep it coming. Don't be deterred from entering information into your PPR. It's kind of a sweet spot to figure out how much do I enter. We really want to focus on kind of the results, outcomes. So what is the result of an effort that's taken place? And always remember that an outsider is reading your report, so make sure that what you write is clear to a new person. So back to what insights are starting to emerge. So remember, outputs are your friend in reporting. So you have created a chain of outcomes and developed approaches to ignite that chain of outcomes. The outputs are the planned product of your effort, the movement, the measurable change and results. But it's short to the point, clear, and easy to understand. Outputs are your friend in sharing updates with your network. Follow those outputs. A well-crafted output will take you to your outcome. And write for an audience who doesn't know anything about your work. So remember, all roads lead to, if I have an approach and I have my outputs and I implement my outputs, I will see outcomes, which is what we're hoping for. All right, so you can brainstorm on your own or with your colleague or another AOK coordinator, but ask these questions to yourself. So this is kind of our question and answer segment. What ideas, insights, or questions has this triggered for you? All right, next steps and closing. So what are the next steps? So the state team is available for one-on-one feedback or office hours. When you reach 50% of an approach, why don't you try it out? We'll experiment. Complete a reflection in tracking process and outcome record. And the Jamboard, what I'll do is I'll put the PDF of what the other coordinators discussed in this meeting onto a shared drive so that it's accessible for folks to look at. And always, thank you for being present. Thank you for submitting your PPRs. Thank you for attending an online webinar about something that you didn't get to participate in live. So I appreciate you. Thank you and have a great day.